at a time when the world is battling the COVID pandemic, India is the 4th worst hit country in the world as we near the 5 lakh mark. We know that what it feels like when a loved one of ours is detected with COVID, when doctors tell you that the patient needs plasma therapy but there isn't any available in the hospital, the desperation, the franticness and the helplessness with which families have to go from pillar to post just to find that life-saving plasma. My guests today who join me are two people who founded a website called Dhoond.com. Dhoond in Hindi means to find. This website allows the patient to register his details, get matched with a donor and you connect. Simply put, if you are looking for plasma, this website allows you to explore that option. I'm joined by Mr. Aditya Mal, founder of Dhoond.com, Mr. Mukul Pava, who engineered the website from across India, and Rohit Kohli, a donor himself. Let me go right across to the founder himself, Mr. Aditya Mal. Good evening, Mr. Aditya. Thank you for speaking to us. And I want to begin by saying that this was a personal struggle and experience. And I say that because I know a family member of yours was being treated and was in dire need of plasma. For what made you launch Dhoond.com and why did you do so? Tell us your story. What was the need?
Thanks for having me on the show. I think I'm going to use this platform as much as I can to get donors in. A few weeks ago, my father-in-law was infected with coronavirus. I think till then, we were all in our bubble where it was something that was happening outside our security safe space. But when he did get infected for a week, he was fine. But in the second week, he needed to be admitted in hospital. We got lucky that we found a place in the hospital. And then within a couple of days, he required to be admitted into the ICU. And that's when it started getting a little scary because soon after that, the doctors said he's going to need plasma therapy. And the search took us about 4 days. And, when somebody is in that kind of a situation, then every minute is a very tortuous
right.
Very harrowing. And there were numerous reasons why it took us 4 days. Some of them were, not being able to find a donor. Some of them were information gaps. Fortunately, we got lucky and, he's cured and he's back home now. But when he did come back home, we felt that if we were going through this, then there must be countless families like us who were going through this as well. Maybe this is a problem that shouldn't exist in the 21st century with the
Absolutely. Internet. So let me, then that brings me to the question. We don't know if this method is 100% effective. We don't know that. But when you were thinking of this idea, because it all begins with an idea, I'm sure you took expert opinions on this. And who were these experts that you took opinion of? And now that you are helping others, how has the response been like?
So you're right. This is not a 100% effective therapy. It's still in trial phases. And in fact, to that extent, it's the doctor who has to recommend it.
Absolutely.
It's not, it has to be prescribed. It has to be on the case sheet and so on. But it also at the same time seems to be scarily the line of last defense, because if you look at the how these things progress, then when it comes to plasma therapy as such, it means that it's reached a critical stage. So to that extent, it is required, but you're right, it's not 100% proven, and it is in trial phases.
Right. So what has been the response like to you? I know there are 100, correct me if I'm wrong, donors listed on your website already. And how many hits and how many have registered and how many success stories from Dhoond.com?
So we've got at the moment 920 patients.
Right.
We have about 201, I think is the latest count,
okay.
donors. But there are numerous things that make a donor eligible. One of them being, has the donor recovered in the last 10 days, or 14 days.
Okay.
Which makes, that's one criteria. Then there's criteria of, the general health. There's criteria around, do they have the antibodies and so on.
Right.
So when you start filtering out all of that, you get to, at the moment, we've got 76 eligible donors who've all been matched. We've got people coming in more, but not at the same speed as we've got patients coming in. I think we've been able to match all the donors that are eligible.
Okay,
and
that's interesting. You're saying you've been able to match all the donors that have been registered so far?
Yes, we have. We haven't gotten confirmation from all of them.
Okay.
And at this point in time, we're not even asking for a confirmation.
All right.
Because I guess patients and their families are in already a fairly chaotic state.
Right.
Which we understand totally.
Okay.
So we're just connecting and moving on.
Right. So I'm going to go to London now, because your friend Mr. Mukul Pava, who engineered this website, correct me if I'm wrong, because you're in London. It wasn't easy for you to see your friend go through this harrowing experience, but you helped him from far across continents, and within a matter of, I think, 3 or 4 days, you put up this website, which received an overwhelming response. Tell us a little bit about that, Mr. Pava.
When Advitya and I were talking about this, that was actually just about 3 weeks ago, under 3 weeks ago.
Right.
And we were thinking about, how his father-in-law needed this plasma, and there would be other people who required it. So we wanted to do it very quickly. One of the things was that when we decided to build this on a weekend, we thought, we want to do this very quickly. So I spent some time using a lot of things that I'd done before. We got a website up and ready on the Friday, and we started sharing it with the groups of people that we knew on WhatsApp and just on social media.
Right.
And it had about 20,000 hits by the weekend. And that actually, personally, that drove me to continue to work on this and build it further. Just the fact that, we were making something that was solving a problem and people were coming to it. It was people who were interested in it.
All right. We seem to have lost that connection with Mr. Mukul Pava right now, as he joins us from London. But I'm going to go to Mr. Rohit Kohli. We can call him a success story because he's a donor himself who matched on Dhoon.com. So, Mr. Rohit Kohli, thank you for speaking to us. A very good evening. Why don't you go ahead and tell the viewer how easy or how complex is this process of helping somebody through a website, because it's all tech-based, but also just break it down to our viewer.
So thank you for having me. First of all, I have not had the pleasure of meeting Aditya, but I salute him because this is obviously a very, very noble, cause that they have latched onto. I think Absolutely. I want to tell everyone, start by telling everybody that what is key and what is the core of all of this is that people need not be scared of COVID. There is a lot of anxiety, there's a lot of fear around this, and also there's a lot of stigma that is attached to COVID right now. Okay, I got it fairly early on, in the path of the journey of this pandemic in India, and obviously I also had a lot of anxiety when I went through this. But when I registered onto, so the moment I got my discharge from home isolation, the first thing I did was register on Dhoon. Okay, I obviously got through social media and through WhatsApp, the university or WhatsApp channels, and I saw it. And my wife and I immediately registered ourselves because I think all of us, everybody who's been through this, 250, 60,000 plus recoveries in India, everybody needs to log on to this or something similar immediately. And I think what we need really is more awareness that this exists. I know there are a lot of people out there who are willing to, maybe they don't know how to. To answer your question, the process of registering was very easy. Actually, to be honest, I did it while sitting in the car. It took me under 5 minutes. And within a few hours, I got a call from somebody from Dhoon to ask me a few follow-up questions, and that was it. I was on the site, I was in, And I actually got a few calls after that. Unfortunately, I did match, with them specifically.
Okay,
but
so,
I think it is.
Sorry, I'm really sorry. I have to, because you said something very interesting, Mr. Kohli. You said this, that you were inside your car and within 5 minutes you registered yourself on Dhoon.com. So I think that implies that it's easy, given that in the 21st century we're all trying to connect technologically. So you're saying that it's easy for starters.
It's very simple. It's a very, very simple form. I found nothing wrong with it. It was and it doesn't ask you anything personal. It doesn't ask any more information than they need to ask.
Okay.
So I don't think anyone will have a challenge, logging into this.
All right.
Or registering.
All right. So for viewers, for anybody, I mean, if you're looking for plasma, and I'm saying this because we have somebody who has gone through the process of registering himself. It's not just about Dhoon.com. You can find a similar place or a forum where you can help others, but the need of the hour is plasma, and plasma therapy is, of course, we don't know if it's 100% effective, but we do know that people who have been trying to help each other out, they are pretty much there, they're halfway there. I want final thoughts. I'm going to go to Mr. Aditya, Mr. Mal. For his final thoughts, I just want to ask you a quick question. Is there something you'd like to point out or say to any person who's going through this experience himself? What are your words for him, word of advice for those people who are actually going from pillar to post?
Think of us as your extended family. I think that's the only thing I would say. I know what it feels like when it was happening to us. All the children in the family were just running pillar to post. You use those words. Felt every emotion of desperation. We get it,
right?
And we're going to keep doing our best to help you guys.
All right. Thank you, gentlemen. Thank you very much for speaking to us. It's not, like I said, not just about Dhoon.com, but it is the way forward. Looking way forward, we know that plasma therapy for COVID patients is a hit and trial experience. But at the same time, people who are really going and extending a lending hand, a helping hand, have really success stories to share. Thank you very much, Mr. Aditya Mal, Mr. Rohit Kohli, and of course, Mr. Pava, who joined us earlier in this conversation.